This is a mini lecture over liver disease, specifically focusing on alcoholic cirrhosis by Jocelyn Soto. Let's talk about the pathophysiology of cirrhosis. This is a condition in which the liver is scarred and permanently damaged. Functional liver tissue is gradually destroyed and replaced by fibrous scar tissue. Hepatocytes and liver lobules are destroyed, resulting in the loss of metabolic function of the liver. Fibrous connective tissue forms constrictive bands that disrupt the blood flow and bile flow within the liver lobules. Scar tissue blocks the flow of blood through the liver to the inferior vena cava. This scar tissue prevents the liver from performing important functions such as processing nutrients, hormones, and detoxifying drugs and poisons, including alcohol. Excessive alcohol intake is the most common cause of cirrhosis. Alcoholic cirrhosis is directly related to the chronic abuse of alcohol and is the end result of alcoholic liver disease. Alcohol causes metabolic changes in the liver because triglycerides and fatty acid synthesis increases, and a decrease in formation and release of lipoproteins leads to fatty liver. With continued alcohol use, inflammatory cells infiltrate the liver, which causes necrosis, fibrosis, and destruction of liver. In the final stage of alcoholic cirrhosis, you'll see regenerative nodules form, and the liver shrinks and develops a nodular appearance. In the picture above, you'll see the progression of alcoholic liver injury from a healthy liver to a fatty liver with scarring, inflammation, and structural distortion leading to cirrhosis, the third picture. As a complication of cirrhosis, hepatocellular carcinoma may occur, which is also known as liver cancer. Risk factors for alcoholic cirrhosis. Of course, the most significant would be alcohol abuse. And this is a person that drinks heavily for at least 8 years. According to the National Institute on Alcohol Abuse and Alcoholism, defines a heavy drinker as drinking 5 or more drinks in one day on at least 5 of the past 30 days. Being female, because females do not have as many enzymes in their stomachs to break down alcohol particles compared to men, and so because of this, more alcohol is able to reach the liver and make scar tissue. Genetic factors, such as deficiency in enzymes that help to eliminate alcohol. Obesity, because a high-fat diet mixed with alcohol can contribute to a fatty liver, which would increase your risk to develop alcoholic cirrhosis faster, and also hepatitis C. Signs and symptoms of alcoholic cirrhosis include jaundice, which is yellowing of the skin and eyes caused by a buildup of bilirubin, and this is showed here in the bottom right picture of the person's eye. Splenomegaly, which is an enlarged spleen caused by portal hypertension because of that redirected blood flow from the liver to other organs. Anemia, which is a result of the splenomegaly, removing red blood cells from the blood too quickly. Spiderangiomas, which is caused by an increased estrogen in the system, and this is shown in the left middle picture there. It kind of looks like a spider vein. Pruritus, which is itching from bile salt deposits. Erythema of the palms, which you could see there in that top right picture of the person's hands. You can see they're more red than normal. Gynecomastia, which is enlarged breast in males due to hormonal imbalance. Thrombocytopenia, which is impaired coagulation because clotting factors are not being produced by the liver. Ascites, which is fluid buildup in the abdomen due to hypoalbuminemia. And here you can see that in the picture down in the left of that person's enlarged abdomen. Kind of almost looks like pregnancy, super rounded and distended. They will also see clay-colored stools from the buildup of bile. And then caput medusae, which is blood from the portal venous system, which is shunted through the umbilical veins into the abdominal wall veins, which manifests as the picture you see up top on the left of the person with those large veins under the skin through the abdomen. And then finally, fetor hepaticus, which is a foul, musty breath, because the liver is just not filtering out those toxins, so it's just trying to escape through the skin and through the mucous membranes out through the mouth. Complications you could see from alcoholic cirrhosis is portal hypertension, and this is elevated pressure in the portal venous system, which the portal vein is the major vein that leads to the liver. So once that gets blocked off, that's why you see portal hypertension. You can also see esophageal varices rupture. Basically, esophageal varices from the buildup of that pressure into the esophagus can cause varices, which is enlarged veins, and eventually those can rupture. You can also see hepatic encephalopathy, which is the buildup of ammonia because your body is just not filtering that out anymore. You can also see hemorrhage, which could be from the esophageal varices. It could be from the thrombocytopenia because they're not producing enough clotting factors anymore, so they're more risk for heavy bleeding. Also liver failure, obviously, and death. Some labs and diagnostic tests that can be run for alcoholic cirrhosis include a CBC with differentials. Again, you can see low red blood cells, low platelets, high white blood cells if they're suffering from ascites in case of infection, things like that. Liver function tests, see what the ASTs are doing, the ALT ranges, BMP, because the BMP would show the electrolyte imbalances that may occur, and then PT and INR could be affected with the coagulation, bilirubin, which could be high and cause the jaundice, ammonia levels, which could cause the hepatic encephalopathy, and then the albumin. Those levels would normally show low, which would create the edema or the ascites. Some tests that could be run is an abdominal ultrasound, an endoscopy for those esophageal varices, a liver biopsy, a CT, and MRI. Medication treatments that can be given for alcoholic cirrhosis or complications caused by alcoholic cirrhosis are diuretics, such as spironolactone, and this could be used to treat edema or ascites or any extra fluid buildup. Albumin, because again, normally people with alcoholic cirrhosis have low albumin levels, and by giving them albumin, this helps keep the fluid in their bloodstream so it doesn't leak into other tissues, such as the abdomen. Lactulose and neomycin, these can be given together to treat hepatic encephalopathy, and lactulose reduces ammonia levels through the bowels. Nadolol with isosorbide to prevent rebleeding from esophageal varices and lowers hepatic venous pressure. So that helps with the portal hypertension. Disulfiram, which diminishes cravings for alcohol. So if anyone who has alcoholic cirrhosis and is still actively abusing alcohol, they can be given this to kind of defer them from continuing to drink alcohol, because when they're taking this medication and they do drink alcohol, it will make them really sick. But compliance is very important with that drug. Vitamins such as thiamine B1, which would help with or to prevent alcohol-Wernicke encephalopathy. Folic acid, and this would correct vitamin deficiencies caused by alcoholic abuse. And then vitamin K to reduce the risk of bleeding. Other treatments that can be done for alcoholic cirrhosis, one, most importantly, is diet changes. Someone with alcoholic cirrhosis should limit their foods high in fat and salt. They should also reduce the amount of animal proteins that they consume to minimize the buildup of toxins such as the ammonia levels to reduce their risk for hepatic encephalopathy. Another treatment is transjugular intrahepatic portosystemic shunt, which is also known as TIPS. This could be done to relieve the portal hypertension. They could also get a paracentesis if they're suffering from ascites to remove excess fluid buildup in the abdomen. Also, a transplantation, a liver transplant. This could be done for clients with irreversible progressive cirrhosis. But again, if a client is still drinking alcohol, they will probably not be considered for a liver transplant. So they would have to show compliance with medications, treatments, and alcohol abstinence for a certain amount of time. Also, skincare is really important, again, because alcoholic cirrhosis clients normally suffer from jaundice, and that can lead to bile salt deposits in the skin, which could be extremely itchy, which could cause them to really itch and break open that skin, which could lead to infections and such. So we really want to manage our skincare. Some nursing diagnosis that can be related to alcoholic cirrhosis would be fluid volume excess, again, because of the risk of ascites and edema, risk for infection, again, because if someone has ascites, they can end up with a host of different infections, such as bacterial peritonitis or infections from itching their skin a lot, things like that. Also, risk for mental status deficits. If someone is not compliant with their diet and they're eating a lot of proteins, and that a buildup of ammonia happens, and they are at risk for hepatic encephalopathy, which can cause severe mental deficits such as confusion, things like that. Imbalanced nutrition, less than body requirements. Disturbed body image. Again, people can suffer from jaundice or that fetor hepaticus, which kind of makes them smell bad. So there's a lot of risk for having that disturbed body image. And finally, here is a list of the references that were used for this mini lecture. I appreciate you listening and hope it was helpful. Thank you.